our pre-meeting stuff. Quick moment of silence.
That is probably, I believe, since about the 16th or 17th of March. Please note that figure does not represent the number of active cases of the virus. The breakdown, we have 17 of the 29 are female. The vast majority of the cases are in the 80107 zip code, which is Greater Elizabeth. Again, there's about a little over 12,000 residents in that zip code. The average age for those that have tested positive is about 51 and a half years old. The median age is 53. The median age being half the cases are lower than 53. Half the cases are people aged 53 and older. Quick look at the statewide data. There are over 14,000 cases as of last night's report from the Colorado Department of Public Health and Environment. 2,571 of those have been hospitalized. There have been confirmed cases of the virus in 56 of the 64 counties in Colorado. Testing continues to ramp up. A little over 67,000 people have been tested statewide. Sadly, there have been 736 deaths due to the virus. And also, there have been 149 outbreaks in skilled nursing facilities or assisted living facilities, which is of great concern. Fortunately, in Elbert County, our nursing facilities, skilled nursing facilities, have not had an outbreak yet. So thank you to all those staff that work within the county, public health staff, acute care staff at hospitals, first responders, law enforcement, everybody that is contributing to mitigating the community transmission of the virus. Your work, often unappreciated by a lot of folks. We certainly do notice it, though. So thank you very much to everyone involved. Sunday night, Governor Polis issued a 6-page executive order outlining Colorado's new safer at home phase of the coronavirus crisis as our state begins to gradually ease restrictions on people's movements, which started this past Monday. The safer at home order is tentatively set to run through May and expire on May 27th. It can be extended or amended at any time, however. Under the order, Coloradans will not be able to recreate beyond 10 miles from their homes and are prohibited from gathering in groups of 10 or more people. I'll speak a little bit more on the gathering of 10 or more. There are opportunities to apply to CDPHE for waivers of parts of the executive order and the accompanying public health order. So that'll have a little bit of impact on some of the activities scheduled for graduation. I'll talk about that in a moment. Some other of the big highlights of the executive order include curbside retail sales began this past Monday. Also, real estate showings, but not open houses, were able to resume this past Monday. Voluntary or elective medical, dental, or veterinary surgeries and procedures may have resumed on Monday if facilities are following required safety protocols. That includes social distancing to the extent possible, using face coverings, regular washing or sanitizing of hands and high-touch surfaces in the facilities, and so on, that I think most folks are probably familiar with. Beginning May 1st, retail stores can reopen for in-person shopping. Personal services businesses like barbershops, salons, personal trainers, tattoo parlors, they can reopen as well. Again, all businesses must follow strict social distancing measures. If you've been to the supermarket or grocery store lately, you've probably seen stickers on the floor and guidance throughout the aisles, encouraging folks to use appropriate distancing practices. Beginning on May 4th, business offices can reopen with up to half of their workforce as long as they, again, follow the strict social distancing measures. Telecommuting is strongly encouraged whenever possible. Employers are also directed to accommodate workers with childcare responsibilities or those who live in the same house as someone vulnerable to the coronavirus by allowing them to telecommute or have a flexible schedule to the greatest extent possible. Next, I'd like to transition to some encouraging news. First of all, got some great news, I believe, yesterday morning in an email from the Colorado Health Foundation. The Colorado Health Foundation made a donation of $14,000 to Elbert County Public Health for our use to combat the virus and its implications, its impact on the county as best as we see fit. So I want to publicly acknowledge Karen McNeil Miller, the CEO of the Colorado Health Foundation, and her team for that generous gift that can go a long way in terms of ramping up testing opportunities, getting the necessary PPE supplies, and a lot of other resources that we need to continue the fight against the community spread of the virus. Some other encouraging news: in Monday's press briefing, Governor Polis highlighted two measures that have been guiding his decision-making processes to begin a stepwise reintroduction of daily activities across the state. The first one focused on a case growth rate metric, which shows how quickly the rate of cases is going up, the rate of infections are going up. He put up some charts that showed that the rate of the new cases has been under 10% and has stayed under 10% for the past month. This decline is a reduction of the collective efforts of folks around the state that they've taken as part of the stay-at-home guidelines, the social distancing that everyone's been practicing, just the general good behavior that Coloradans have taken to stop the spread of the virus. Recently, the case growth rate has been around 5%, which shows a leveling off of new cases. So you've certainly heard of the flattening the curve verbiage being used for quite some time now. So this is in part one of the metrics that folks are, leadership is looking at in that larger flattening the curve conversation. The second measure that he looked at, or that he highlighted, focused on the hospitalization growth rate. And that is simply the number of hospitalizations for the coronavirus. And it has been thankfully declining for a number of weeks. Again, good news. It's important to spread out or flatten the number of cases of infections necessitating hospitalization, so that our healthcare system does not get overwhelmed. We can protect healthcare and first responders as best we can. So that is an important measure. There's probably another several measures that state leadership looks at to guide their decision-making process. So we are making progress in the right direction. So I certainly want to thank all of our citizens for their efforts in adhering to the social distancing and the other recommendations. We are not home yet. We've still got a good ways to go, but we are still making decisions based on the best available data. I would encourage everyone to hold steady, and I know it's been a tough time these last several weeks, and we do worry about people's physical health, their well-being, their mental health, but we are making progress, so that's certainly encouraging. Now, speaking of progress, one of the things that we have been without in the county is an option for testing. Obviously, we don't have a hospital. We have limited primary care options for folks. But we are soon, hopefully within a week or so, going to have a testing option available for county employees, for citizens, for emergency service folks, for healthcare workers that may live in Elbert County and work outside the county, for high-risk residents, certainly those folks over the age of 60, and those that are immunocompromised. Also want to make sure that folks that work in service industry roles that have high contact rates with the general public, whether that's at a grocery store or another retail environment, that they have an option for testing. So we are in conversations with Peak Vista Community Health Clinic. There is a clinic here in Kiowa, and we look forward to getting that memorandum of understanding squared away so that we can begin testing prioritized folks, including our sheriff's office staff that mans the jail and the inmates within the jail. I want to thank Sheriff Tim Norton for identifying a resource through the Colorado Sheriff's Association for the testing kits that will provide an initial supply of kits to begin this important component of our community response. Once we have a better handle on the number of Elbert County residents that have been tested, and we understand how many and what percentage have subsequently been tested positive, we can more aggressively approach the contact tracing to look at who they've been in contact with, whether that's family or friends, or where they've been in the community, and hope to identify geographic priorities through that approach. So again, Governor Polis has a goal of having at least one testing facility in every county. Obviously, that's been hard in Elbert County with our dearth of healthcare resources. He has identified a goal of 10,000 tests to be conducted statewide. That is a heavy lift. My understanding is that some experts have put that figure closer to 6,000, 7,500 tests a day to get a good understanding of how the virus is spreading, but I believe the governor would still like to shoot for that 10,000 mark. What does that mean here in Elbert County? I'd like to initially see about 150 tests done per 10,000 residents. That's a fair public health measure. So with our population of around 28,000, hopefully our 500 test kits will get us to that point over the next month or however long it takes to get folks tested at that level. We are told by the state that more testing resources are on the way. The supply chain challenges that the nation has experienced have been eased up a little bit. So hopefully those resources will be coming. I don't want to put a timeline on anything, but we've got our initial set of test resources, and we'll supplement them ideally with some help from the state. Continuing on about the hospitalizations, statewide, currently we have fewer hospitalizations than we did a week ago and fewer than 2 weeks ago. With the new cases and hospitalizations leveling off, along with other metrics with progress in supply chains and hospital capacity, modeling projections, The governor has stated a comfort level in the state's ability to handle caseloads. So hopefully the worst is behind us. We do want to ask folks to remain vigilant, and you may notice that I have around my neck a face covering. We encourage folks to wear face coverings when they go out to run their errands, whether that's to the grocery store, the pharmacy, physician appointments, wherever they need to go. Ideally, folks would continue to stay home more than would be typical, but not as much obviously under the stay-at-home order. We understand that folks need to get out, get some fresh air, and recreate. When you do go out, please use a face covering. That covering, so everyone understands, is not protecting yourself, it's protecting others in the community. So it's important to make a commitment to protect your family, your friends, your neighbors, particularly those older residents of the county that are most vulnerable to an infection. When I go out, I also wear, I was able to find an N95 particulate respirator that I put on my face and then put the face covering over that. So again, the reason for the face covering is to stop or at least mitigate the spread of droplets that come out of our mouths sometimes as we talk, and that aerosolization of the virus that can be picked up when folks are in close proximity. Touching on the waivers that I mentioned to the state executive order and the state public health order, any component of either of those orders can be petitioned for a waiver from the restrictions in that order. One of the most prominent is the restriction, continued restriction on the maximum of 10 people gathering in one location. Obviously, we have graduation season coming up with our high schools. It's been a tough road for them, for the seniors particularly, and we want to try to honor their accomplishments in as normal a fashion as we can. So I have been in contact with all the school district superintendents to discuss potential options for their upcoming high school graduations. We will be submitting, well, let me talk about the process first. So in order to submit a request for a waiver, and the waiver request would go to the Colorado Department of Public Health and Environment. They would review it along with epidemiological data on the volume and rate of cases in our community. Because we have such a comparatively small population in our community, and thankfully a comparatively small number of cases in our community, some of the metrics that they put forth really don't apply to us. For example, a 14-day decline in the number of cases or the number of hospitalizations. We simply can't make that case. We can put our best foot forward and make the case for the natural social distancing that is inherent in a rural community, the good work that's been done thus far to mitigate community transmission, and the other layers of protection. And hopefully it will be looked upon favorably, but again, to just get back to the process, so the public health administrator, being me, has to approve the initial request from, in this case, a school or a school district. The Board of Health would then need to approve, if I recommended approval for it, the Board of Health would need to approve it. We would put that, the Board of Health would put that in writing. We would include that in the application for the waiver and send it to CDPHE for consideration and hopefully approval. I anticipate that a lot of school districts and schools around the state will be asking for a waiver so that their high school seniors can graduate. The graduation will most likely be a modified ceremony in some form to the extent possible. We want folks to social distance. That may mean, for example, for smaller school districts, that parents or guests are limited to have a limited number of attendees, and they may have to, for example, stay in their car around the perimeter of a football field. One thing I can say with certainty, there will not be any indoor graduations. They will need to be outside to allow for maximum social distancing to mitigate the potential spread of the virus, as well as other provisions that will be burdensome for sure to families and schools, but we want our high school seniors to enjoy this time and again, hopefully provide them with as normal celebration as we can accommodate. So CDPHE anticipates that there will be a several-day turnaround window. They had initially stated 3 to 4 days. I think conservatively that's probably closer to a week. In the anticipated volume of requests for waivers. So in speaking with individual school districts, we are looking to get them in as soon as we can, certainly by sometime next week, to allow for ample time for CDPHE to arrive at a decision, and then for us to be able to communicate that decision back to the school districts and have them subsequently message that to their schools and families. I do want to highlight a resource. Again, the Maine Colorado COVID-19 website is covid19.colorado.gov. There are a number of links and a wealth of information on that very comprehensive website. One of them is the symptom tracker. That is the electronic platform where folks that may be experiencing symptoms of a virus infection can voluntarily input their symptoms, their date of onset, gender, race, ethnicity, things like that, so we can have, again, a better understanding of where the virus is in our communities across the state. I checked it this morning. To date, there have only been 2 individuals that have entered information into that. So if folks are comfortable sharing that information anonymously, we would greatly appreciate them doing so. Lastly, I want to thank Elbert County's COVID-19 leadership team, Alex Jakubowski. I'm going to make sure I get that right this time. Sam Albrecht, Eileen Krauth, Bart Greer, Sheriff Tim Norton, Commissioner Richardson, and the other commissioners providing support for this, as well as, again, the entire Elbert County community. We're going to get through this. It's not going to be easy, but there are brighter days ahead, I'm sure of it. So with that, I will turn it back to the commissioners for any questions.
Do you have anything specific? Okay. One, thank you. I know there's a buried in what is kind of continuing gloom. There were some good points there. I definitely would like to get a letter out from us to thank the Colorado Health Foundation for their generous contribution. I know and I appreciate you working with the schools to try to design something that's safe, that comes close to a traditional graduation, or at least accommodates some healthy alternatives to that. I think in order to help speed that process, I'd be happy now to just take a motion that we support reasonable requests to accommodate safe alternatives to standard graduation practices, so we don't have to spin up another meeting to approve a letter by the Board of Health. I think that makes sense at this point, just based on what you're working on. So if one of you would like to.
I'll make a motion that we approve a letter endorsing the variance for the graduations for the different schools in the town, or in the county.
Second it.
Okay, we have a motion and a second to support submission of reasonable alternatives to graduation ceremonies. All in favor, please say aye.
Aye.
Aye. Okay. The other, just since the subject had come up, I think it's a good time to discuss, a broader waiver to allow county discretion based on our knowledge of our data in our area. I know you talked at length about what the state sees and, the social distancing that's inherent in our rural county. Again, our numbers thankfully have not gotten to the point where you can actually do statistical trending with them, but we know they're very low and they're very concentrated. So I think it would be appropriate to look at a broader waiver that gives us the discretion geographically to look at appropriate gathering sizes in various parts of the county, potentially relaxation of measures that make sense in certain parts of the county or to certain businesses based on how some of our smaller, when we look at retail, non-critical retail, there's a large number of shops that don't even accommodate more than 1 or 2 people in the shop at any given time. So I think with our own local knowledge, the pending testing, it would be wise to put something in that allows us to start executing locally what makes sense locally as our data refines. So I don't know if that's something you guys are interested in.
I think that's a good idea. In other words, if I understand what you're saying correctly, is recognition of the nature of Elbert County.
Right.
And I'm amused by your 10-mile thing. I live 16 miles from the nearest town, and most of the people are gathered around in the eastern part of the county. That's common. In fact, some of them live 30 miles from the near. So the distances and all of those kind of things, nature takes care of it for us. But what the chairman said is very important. We need to ask for some waivers that recognize the nature of the community.
I agree. We need to be looking at, trying to help the businesses and stuff in this county get back with the precautions, that the state has put out and everything. But I think we need to try and ease some of that just for the fact of being the rural county, and I think people are going to be responsible enough to do what they need to protect themselves and their neighbors.
Yeah, I do think that's been shown. I guess the other concern I have is just as we saw kind of the mad scramble as Safe at Home was ending without anything in writing to take we did get something Sunday. I'd argue that's about a week too late to have guidance in writing out to individuals, businesses, employers to know what's supposed to happen when they wake up in the morning the next day. So if we can do something that provides us that broader discretion that perpetuates, if we get something in very soon and it takes a week for the state, we're still pushing up close against what happens next on the 27th. So I think anything that allows us to provide better predictability also helps us with our communications plan, and I think the more people understand and have clarity on what's expected of them, like I said, the state's order on looking at, urging us to look at what makes sense to ensure the most compliance. I think the most compliance is going to be when it's voluntary, and that's when people actually understand what is asked of them and why. So
I just need to ask a question. The mechanics of seeking this waiver, do we do it as the Board of Health, or do you do it as our knowledgeable person?
So I will make a recommendation to y'all, and then y'all will discuss and arrive at a decision, and then we'll put that in writing to CDPHE. My understanding is that in the example of the high schools, for example, each high school or school district will need to submit a waiver.
No.
However, to Commissioner Richardson's point, I think we're talking about one blanket waiver, if that's an appropriate.
Yeah, I
way
was
to-
thinking something akin to what Mesa County and Eagle County had put together.
Yeah.
I looked at those plans. They're essentially the Director Administrator of Public Health is the designer and submitter with the approval of the Board of Health. So probably a Board of Health letter, a submission from your office, and then with whatever supporting documentation allows CDPHE to make a determination. So.
Yeah, and I think as circumstances or situations arrive, certainly, let's say, for example, if a waiver, a larger, more far-reaching waiver were to be approved, and then as individual circumstances or situations arrive, we'd come back and discuss it on a case-by-case basis. You know, given some commonalities for certain businesses or industries, but one of the points I want to make, certainly to the citizens, is that we make a real effort to look at the public health needs from the lens of rural public health. And we understand that there's many diverse communities around the state, and there's not ever going to be a one-size-fits-all. And some of the things that work for metro area counties or suburban communities, suburban counties, don't apply and don't work. And we have some of our own considerations. Just the other day on a state call, I brought up branding of spring calves and how that's impossible to assure social distancing. And that's just an example of something that I'm sure somebody in a larger metropolitan area had not thought of. So they conceded that when something like that is as clear cut as it is, you know, no request for waiver is needed. So those types of issues that are specific or inherent to our community, we certainly want to make sure all consideration is given to any request.
No, I thank you for that. It's an interesting response that when something is clear cut, you don't need a waiver to an order that is fairly definitive. So I think that just points more towards the need for us to work towards defining our own destiny, because things that may be clear cut to us, and that was accepted as a clear cut example, if
I
it's
wanted to
not
get that on the
recognized as-
record
if it's not clear
with the
yeah.
state conversation.
Yeah, and I was going to say, not to throw anyone under the bus in that, but there are things that happen naturally or regularly in our communities that support agriculture and other things that may not be as clear cut to somebody else. That it's just interesting that the trigger was pulled quickly. That that makes sense. You wouldn't have to do a waiver. I submit that we know what makes sense. So if we can put something in place where what makes sense and what is supported by our local data, that we gain ourselves a little freedom to serve our citizens a little more directly. So if we could start working on that, that would be good. And I guess, again, just the approval timelines and the fact that somebody somewhere in the capital is, or working from home, is already thinking about what the next order should be saying. It's important to get something in as soon as we can, so we're not winning this battle and turning into, you know, now we're looking at another order that may require, you know, a complete relook again. So I think the sooner is better. So thanks. Alrighty.
And that sooner is better, as I've already had 2 calls this morning from people that have businesses trying to figure out how to get their people back to work. And it's a real question. And, you know, they're small contractors that have 8 to 10 people working for them. And they work outside. They do almost all the things that give them natural distancing. So anything we can do to help these people get back to work, if you will, or get the economy, or recognize the economy as being, it needs the help.
Yeah, thank you for bringing that up, Commissioner. I have to date received maybe about 10 or 12 calls from individuals just seeking clarification on what the order means, and some with specific questions. Some folks just want to be heard, so we're, would encourage folks to either connect with me via email or phone and let me know your concerns, or if you have questions, certainly I'll get back to you as quickly as I can with an answer.
And I do understand the confusion. I mean, the specific example of gyms are closed now other than to support small numbers working with a private trainer or a personal trainer. But at the same time, fitness centers and HOAs, condos, and hotels are open as long as they clean regularly and follow a list of 2 or 3 practices that were listed. So I understand the confusion, and I also understand the fact that when the order was written, if somebody was, had in mind a gymnasium that might have 100 or more people in it at any given time versus a smaller facility that is more akin to a fitness center to start with. So as we work to accommodate those, again, if there's things that make sense locally and we can get that local freedom, I think that allows us to serve our citizens much more quickly. So we're not waiting. I'm assuming that, there's 178 school districts. There's probably well over 300 high schools in the state or thereabouts. So if everybody's looking at a waiver to accommodate how they want to do business, I can see the state grinding to a halt on other things as well. So if we can get quicker turn that make for reasonable measures for our folks, I think that serves everybody better. I would really just want to take the pressure off the state because I care about the state. Okay. Yeah. Do you have anything else, Dwayne? Or?
That's all.
All
Thank
right.
you.
With that, take a motion to adjourn.
Mr. Chairman, I move we adjourn our Elbert County Board of Health meeting.
Second.
Okay, a motion and a second to adjourn. All in favor, please say aye.
Aye.
Aye. We are adjourned. For anybody that was watching and joined us online, appreciate your attendance. Thank you.
I just realized I forgot to plug the thing tomorrow night.
Yeah, I no, not